Hello friends, recently AIIMS PG exam pattern has changed and people are really worried about the new pattern. So we are here to give you the right advice about the exam pattern. So first of all, I tell you what are the exams and how this marking or scheme. You can see different type of exam pattern are there about which I am going to discuss in detail. But before that, I like to keep a close watch on one entity, that is not review. What is this? You have done a question, you have marked it, but after marking you are not submitted. You think you have a doubt that perhaps I may or may not be correct, and you want to think again. But will you have time later on? Most of the time answer is no, and then you will not be able to submit it. So for God's sake, submit immediately, because if you cannot do right now, nothing will happen again after 1 or 2 hours. Nothing is going to come in your memory. So do not commit mistake of for keeping for review. Submit it. Now, then we have single best answer. In this, it was like previous one. We have 4 options, and if you do rightly, you get 1 mark, and if you do wrong, then 1 by 3 is deducted. It is this pattern of the question where you can take some risk. That means if you have doubt among the any two of the option, then you can think of taking a guess or risk. But if you have doubt for 3 or more than 3 options, then do not do it. Don't create more negative mark by doing wrong answers. But it is one thing, again repeating second time, it's this entity only where you can take some risk. Then multiple true false type. It is just nothing but type of what you have writing PGI exam. And again, in this, for every correct answer you get 1 by 5 plus, and if you do wrong, equal amount is deducted. That means same amount is for positive, same amount gone out for doing wrong. So here, do not take any chance. Do only if you know the answer, you are sure about it, do it, otherwise don't do it. Then match the following. In this, look at this question. There are 4 options, and here there are 6 options are there. If there are 4 and 4, if 4 this, then it becomes a little easier, then you can take some risk. But as options are 6 here, and again, if you do right, you get you are getting 1 by 4. If you do negative, 1 by 4 is going. So do not take chances at all. Do only if you are very sure about it, especially when 6 options are there. Then sequential arrangement type, that means some sequence is there. If you do right, you get +1, and if you do wrong, -1. Again, equal amount of positive and equal amount of negative. Don't take any chances. Do only if you are sure about it. Now, multiple completion type. That means, again, different type of options are there. Correct one plus 1 negative 0.1 by 4. Same pattern, don't take any risk. Reason assertion. Some reason is given, then assertion is there, then they say whether the reason or answer they are matching or not. Same 1 by 4. Don't take any chances. No risk. Extended matching type. Now, if you analyze the AIIMS pattern exam for the last 3 years, they are changing, they are going, gradually they are moving toward USMLE type of exam pattern. About 3 years back, only 1-liner were there. Then about huge amount of picture-based question. Out of 200 questions, 50 questions were picture-based, just like what we are getting in MLE. Now this time, they are a quantum leap has been done, changing the exam pattern, and now this is the, you can say, essay type of questions are there, and long options, a huge list of options, and long questions are there. Exactly, they are, in fact, they are all from MLE-based type of questions are there, right? But 2 cases. But main, what I want you to emphasize, they have given 2 long questions, but 1 mark. That means if you do it right, you get half mark. You do get right, you get half mark. But if you do wrong, again, 1 mark, half and half is gone. Okay, well, that means that this long question, which will consume a large amount of time, it will, in fact, this long question will consume at least 10 questions of one-liner type of question. Will consume. So we have a message for that also. Now let us see what is the need of the hour. The need, what examiner want from you nowadays, your basic concept should be very, very clear, and thorough knowledge of the each subject with integrated approach is mandatory. Now the time is gone that you know only, you just mug up something. It's not required. For example, they will give you an anatomy picture and the radiology picture also, and they will ask you to correlate the two pictures. Now just reading anatomy or just reading radiology, similarly, they will like to correlate medicine with physiology and pharmacology. So not only that, you have to know the medicine, you have to know pharmacology, and you have to able to correlate. This is typical what USMLE exam pattern is coming up. So just reading guides without understanding the basic is totally insufficient. Your basic should be very, very strong. Now some students are getting panicky. You need not worry. The entire team of DBMCI is with you. Each and every faculty, each and every staff is there to help you out in all the possible way. Now in DBMCI, we have been teaching you in the integrated way. This is our way of teaching. Every faculty teach that this way only. It means your class notes of each subject should be your base for your exam preparation. Read your exam class notes of whatever you have been taught in your classes, and just revise your course, what you have studied till now, and do our mock tests. We are conducting AIIMS mock tests. So don't worry about some rare or uncommon questions. They constitute only 5 to 7% of the total number of questions. You don't worry for that. You should focus on the commonly asked topic, which constitute about 95% of the all total questions. And we shall be conducting AIIMS mock based in the new pattern. The first test will be on computer based tests, so-called Champions Live test on 4th April. Please get registered for it because we have got limited seat for this. Then we shall be conducting 5 more AIIMS mock, again based on the latest pattern only. That means in total you will be getting 6 practice tests, which are fair enough to give you idea how the exam is going to be. And you can see the detail about these tests in our website. Do not focus on the rank. This is strong advice to all of you. When you are conducting this, when you are attempting this mock test, don't worry about rank at all. It matters nothing. What should matter, how many positive questions you are done. Okay, that is more important. Remember, the only first type of the question, hanging a single option right, you can take risk. Otherwise, do not take risk. So focus on how many positive you have done it. Your negative should be minimum. In each test, you should get more positive as compared to your previous mock test. This should be your aim, and you should have good speed to do also. Now, I don't need to elaborate on this point because if your speed is not good, then there are many long questions which will take a lot of time. The speed has to be taken into consideration. Now, what are the sequence you should do? Remember, when you go for AIIMS exam, the students are sitting quite close to each other, but question number 1 of this student will not be same as the question number 1 or the other. They change the sequence. That means you may get any question in the beginning, maybe long, maybe short, but how you should do the attempt. This depends on marks, negative, and time, how much time it is going to consume. So first of all, you go through, first you finish all your single best responses. Okay. Then sequential arrangement, multiple, match the following, multiple completion and reason. But this should be definitely done at the last, beyond doubt. Even if question number 1 is this should be done in the last because it is going to consume a lot of time. Others, if you are getting in sequence, suppose because we never know, we don't know what type of sequence they are. Suppose they are giving question 1 to 20 is is single base, you first finish. Then maybe 11 to maybe 21 to 30 is this, then you can skip, then you can come to next one. Okay, so what the idea of talking to you, if they are arranged in package, then you should go follow this sequence. Of course, it is advice. You are the best judge, you can decide whatever way you want, but at least this long question having only half mark weightage should be done in the last is, I think you will agree with me on this point. Now, in addition to that, we'll be doing one test and discussion for AIIMS based latest pattern as the video lectures. It will be just like you can say sure success for AIIMS. An LMR piece of all subject will be also provided. Okay, and in this mainly medicine will be discussed, and we will planning that we have to give other tests also. T&D will be available in the first week of April. For any queries, you can mail to us studentsupport@dbmi.edu.in. We'll be too happy to help you out in all the possible way. DBMCI wishes you all the best for your exam. Thank you very much for watching this video.